Hello, everyone. Welcome to Heart Pattern Differentiation featuring Heart Yang Collapse. This is presented by Lamp Acute Wellness Foundation, Inc. Heart Yang Collapse is a more extreme and more serious condition than Heart Yang deficiency. Yang is now too weak to move blood and body fluids. Heart Yang collapse may be a consequence of kidney Yang deficiency or heart Yang deficiency. This is the same as for heart Yang deficiency. Heart Yang collapse, however, always derives from a chronic and severe deficiency of kidney Yang. Thus, any of the causes of kidney Yang deficiency are indirectly causes of heart Yang collapse. This can be excessive sexual activity, overwork over a long period of time, or a chronic illness. This pattern is an extreme case of heart Yang deficiency and is not substantially different from it. The clinical manifestations are basically the same as for heart Yang deficiency, only more severe. In addition to this, there is cyanosis of lips, which is due to deficient Yang Qi not moving the blood, hence resulting in severe stasis of blood. The coma is caused by the complete collapse of heart Qi. Hence, the mind has no residence. This coma is of the deficiency type. The tongue may be short, that is, cannot be extended much out of the mouth because the deficiency of Yang is so severe that Yang Qi cannot move the tongue muscle at all. Also, the deficiency of Yang generates internal cold, which contracts the muscles. Hence, the tongue cannot be stuck out. The hidden pulse is an extreme case of the deep pulse and reflects the severe deficiency of Yang. The knotted pulse reflects the severe deficiency of Yang not giving the heart enough energy to beat regularly. Clinical manifestations of heart Yang collapse: palpitations, shortness of breath, weak and shallow breathing, profuse sweating, cold limbs, cyanosis of lips, grayish-white complexion, in severe cases, coma. The tongue, very pale or bluish purple, short. Pulse, hidden, minute, knotted. Key symptoms: cyanosis of lips, hidden, minute pulse, cold limbs. Heart Yang collapse always derives from chronic and severe deficiency of kidney Yang. Total collapse of Qi, whether Yin or Yang Qi, always derives from kidney energy collapse, whether kidney Yin or kidney Yang, which is foundation of all energies of the body. A general deficiency of Yang, especially of the spleen and stomach, is also a frequent precursor to this pattern. Stomach Yang is particularly important because the stomach channel controls the great connecting channel of the stomach, Shu Li, which beats in the fifth intercostal space. The pulsation of the left ventricle that can be felt in the fifth intercostal space was called the beat of Shu Li. Heart Yang collapse is a very severe, serious acute condition corresponding broadly to MI, myocardial infarction, in Western medicine. When it does not cause death, the main consequence is severe blood stasis. Treatment principle: rescue yang, restore consciousness, stop sweating. Heart yang collapse is a severe and acute condition in which Western medical intervention is required. Acupuncture points: REN 6, REN 4, REN 8, DO 4, stomach 36, PC 6, bladder 23, DO 20, DO 14, bladder 15. Method: all with reinforcing method, no retention of needle, moxa must be used. This is a severe and acute condition in which Western medical intervention is required. If this is not available, you can choose from REN 4, REN 6, REN 8, DO 4, DO 14, DO 20, bladder 15, stomach 36, and pericardium 6. REN 4, REN 6, REN 8 rescue yang qi and stop sweating if indirect moxibustion on ginger or aconite is applied. DO 4 with moxa tonifies kidney yang. Stomach 36 and PC 6 strengthen heart yang. Bladder 23 with moxa strengthens kidney yang. DO 20 is meeting point of all yang channels, rescues yang and promotes resuscitation if used with direct moxibustion. DO 14 and bladder 15 together can tonify heart yang if direct moxibustion is applied. It is important to stop sweating because profuse sweating will further weaken the heart in two ways. Firstly, a loss of sweat implies loss of defensive qi, which represents a further loss of yang. Secondly, a loss of fluids from sweating leads to a deficiency of blood because of the interchange relation between body fluids and blood. The resulting deficiency of blood will further weaken the heart. REN 4, Guan Yuan, gate of origin, location on the anterior median line of the lower abdomen, 3 tsun below the umbilicus. Classification: front mu point of the small intestine, crossing point of the Ren vessel and the 3 yin meridians of the foot, spleen, liver, and kidney. Functions: strengthens, nourishes the kidneys, qi, yin and yang. Nourishes essence, benefits original qi, calms the shen, benefits menstruation and the uterus. REN 4 has the function to tonify as well as maintain health. Front mu points can be used to treat diseases of the affected Zangfu organ and those of yang meridians and collaterals. They treat diseases of 6 fu organs and diseases of yang meridians. An adverse reaction when a front mu point is pressed can help make a diagnosis. Needling, perpendicular insertion, 1 to 2 tsun. REN 6, Qi high, Sea of Qi. Location on the anterior median line of the lower abdomen, 1.5 tsun below the umbilicus. Functions: strengthens kidney qi and yang, regulates qi, benefits original qi, treats prolapse. REN 6 has the function to tonify as well as maintain health. Needling, perpendicular insertion, 1 to 2 tsun. REN 8, Shen Shiwe, spirit gateway, Location in the middle of the abdomen, in the center of the umbilicus. Functions: rescues yang collapse, resuscitates, warms yang, regulates the intestines. Indirect moxibustion with moxa stick or moxibustion on some type of material like salt and ginger. Do 4. Mingmen Gate of Life. Location on the lumbar region, on the posterior median line, in the depression below the spinous process of the second lumbar vertebra. Functions: tonifies kidney qi and yang, tonifies original qi, nourishes essence, clears heat, strengthens the lumbar region and knees. Do 4 is one of the most effective points to tonify yang and strengthen the constitution. It is especially efficacious if moxa is also used on the point. Needling, oblique insertion upward, 0.5 to 1 tsun. Stomach 36, Zhu San Li, leg 3 miles. On the anterior aspect of the lower leg, 3 tsun, below stomach 35, 1 finger breadth, using the middle finger from the anterior crest of the tibia. Classification: Husi point of the stomach meridian, command point of the abdomen, point of the seawater and grain. Functions: tonifies qi and blood, harmonizes and strengthens the spleen and stomach, strengthens the body and weight qi, raises yang, calms the shen, activates the meridian, stops pain. Stomach 36 is known as one of the most important points to tonify qi and blood and promote general wellness. Husi points are where the qi of the meridian collects and goes deep into the body. Husi points are known to treat rebellious qi and diarrhea. Needling, perpendicular insertion, 1 to 2 tsun. PC6, Nei Guan Inner Gate. Location on the palmar aspect of the forearm, 2 tsun, above the transverse crease of the wrist, on the line connecting PC3 and PC7, between the tendons of palmaris longus and flexor carpi radialis muscles. Classification: Luo connecting point of the pericardium meridian, master point of the yin wei vessel, coupled with spleen 4. Functions: opens the chest, regulates heart qi, calms the shen, harmonizes the stomach, relieves nausea and vomiting, regulates qi. Pericardium 6 is an extremely popular and useful point. It is very helpful in treating insomnia and calming the shen. It also is the point to use for nausea and vomiting. Furthermore, it can be used for any condition related to the chest. Luo connecting points of one meridian can communicate with 2 meridians. They treat diseases of the collaterals and can be used to treat chronic diseases, especially chronic diseases of the Zangfu organs. Clinically, Luo connecting points are often combined with Yuan source points in the treatment of diseases. Needling, perpendicular insertion, 0.5 to 1 tsun. Bladder 23, Shen Shu, kidney shu. Location: on the back, 1.5 tsun, lateral to the lower border of the spinous process of the second lumbar vertebra. Classification: back shu point of the kidney. Functions: strengthens the kidneys, tonifies kidney yang, nourishes kidney yin and essence, strengthens kidneys' ability to grasp qi, benefits the ears and bones, strengthens the low back, resolves dampness. Bladder 23 is one of the most effective points to tonify the kidneys. Back shu points are corresponding points on the back where the qi of the respective zangfu organ is infused. If the five zang organs are diseased, abnormal reactions appear on the back shu points. Back shu points have a direct therapeutic effect on the diseases of the five zang organs. Needling perpendicular insertion 0.5 to 1 sun. Do 20. Bai Hui. 100 meetings. Location on the head 5 sun directly above the midpoint of the anterior hairline, or at the midpoint of the line connecting the apices of the two auricles. Classification: crossing point on the Du vessel with the 6 yang meridians. C of marrow point. Functions: raises yang, treats prolapse, subdues yang, clears the head, calms the shen, dispels interior wind. Needling subcutaneous insertion 0.5 to 0.8 sun. Do 14. Ta Chui, great vertebra. Location on the posterior median line in the depression below the spinous process of the 7th cervical vertebra. Classification: crossing point of the 3 yang meridians of the hand and the 3 yang meridians of the foot. Functions: clears heat, releases the exterior, dispels wind, regulates wei and yin qi, treats malaria. Do 14 is one of the most important points to release the exterior and treat wind heat, cold or flu. It's also a main point in treating summer heat. Needling, oblique insertion upward, 0.5 to 1 sun. Bladder 15. Shin Shu, heart shu. Location: on the back 1.5 sun lateral to the lower border of the spinous process of the 5th thoracic vertebra. Classification: back shu point of the heart. Functions: strengthens and nourishes the heart, calms the shen, regulates heart qi, opens the chest, resolves blood stagnation, clears heart heat or fire. Bladder 15 is one of the best points for insomnia and anxiety, especially if the pattern is due to heat. Needling, oblique insertion 0.5 to 0.8 sun. Let us now summarize heart-yang collapse. Etiology: repressed emotions, chronic illness, blood loss, excessive sexual activity, retention of dampness, overwork, old age. Underlying or accompanying pathology: kidney yang deficiency, heart qi deficiency, heart blood deficiency. Signs and symptoms: palpitations and shortness of breath, weak and shallow breathing, cold limbs, profuse sweating, cyanosis of lips, coma if severe. The pulse: hidden, minute, knotted. Tongue: bluish purple or very pale. Treatment principle: rescue yang and stem sweating. Acupuncture treatment: REN 6, REN 4, and REN 8 are the points to use to rescue yang qi and stop sweating. Do 4 to supplement kidney yang, using moxa. Bladder 23, to strengthen kidney yang using moxa. Stomach 36 and pericardium 6 are the points to use to strengthen heart yang. Do 20, rescue yang. Do 14 and bladder 15 are the points to use to supplement the heart yang using moxa. Needle with supplementation. Thank you very much for your attention and hope to see you in our next videos.